if your child's having open heart surgery, that's definitely a big deal. And so what I try to tell the parents, first of all, we're always very honest with them and very direct, and but we do it with, compassion. And the reality is that if you look at every congenital heart operation, the overall mortality, so the risk of dying, is probably 3% or so, 3 or 4%. Now, there are some heart lesions that it's close to zero, and then there are some heart defects that it's 30 or 40%. And so it's a very individualized conversation depending on the heart lesion. But most of the heart operations can be done very, very safely. And so I try to tell them, here's all the things that could happen, but if you step back and take the 10,000-foot view, none of that is really that common. I mean, we're talking like low single-digit percentages. So, and I try to end with some positivity and some hope, because that is the reality. That look, your child has a 97, 98, 99% chance of coming through the operation just fine, going home, and doing great. And of course, we'll tailor that if the child has a really serious defect and maybe the heart function is poor, then it's a different conversation. But by and large, I find that the parents are reassured after we speak with them. And we have a great team here. We do the full spectrum of pediatric heart disease. So from the most severe single ventricle lesions, so kids that are born with just one pumping chamber, not two, and most of these children can go on and live very happy, fruitful lives, and their parents get a lot of satisfaction out of that. We will never give up on their child, and that their child's in great hands, and that we would do everything that we possibly can to get their child through. And we have a track record of doing that. That we, from the easiest things to the most complex things, I feel confident. I would tell them that I feel confident that we can help them.